Well, hello everyone, and today we'll be talking about together with John on mental health. If you have any questions on that topic, please always comment below the video and we will be answering your questions. My name is Gökçen and I'm making these videos from Basel, Switzerland, now together with John.
Hi there, we're back. I just want to talk about diagnostics and how it's done, right? So mental health diagnostics, how we do it. But before I do that, I want to talk about just what a mental health disorder is. So right now, as of this date, there are no biological markers to psychopathology, right, to mental health problems. And what that, as opposed to any other disease in the body, right, you go to any other field in medicine, and there will automatically be parts of the body and they'll know all about it and how it works and everything else. And this is why your pills work with certain parts of the body and doesn't work with another part, because they figure that out. Mental health doesn't work that way. It basically, from inception, the only way we understand mental health problems is by observation and through the patient telling us what's going on, basically describing the symptoms. And what's happened over time is we've listened to this from many patients and we've created a list of symptoms. We've noticed that certain symptoms cluster. And so we put a circle around that and we call that thing, we just label it, we call that thing anxiety. And then there's another list of symptoms over here and we put a circle around this and we label this by depression. And that's basically how we do diagnosis. It's more detailed than just reading a list of symptoms, because there is also an interaction effect that happens between the therapist and the patient that will lead to a more detailed understanding of what's going on with the symptoms. So the fact that, say, you've been depressed for 2 weeks is a symptom of depression, it may not be true that this is actual depression. So there's a lot of subtleties in the interpretation. So it's not just like a category list. How we sort of categorize mental health problems. In North America, there's what is essentially a book, it's now all online, but it's called the Diagnostic and Statistical Manual of Mental Health, edition number 5, because that's the 5th edition we're into. And that's currently in North America, where there's a list of all the mental health disorders that are possible, that are recognized, and all the symptoms that are related to those disorders. It is easy to go on there and just read the symptoms and say, oh, this is what I got, but it doesn't actually work that way, because there are many exceptions and subcategories, which is why people spend years in training just doing diagnosis. In Europe, indeed most of the World Health Organization has produced another manual, which is called the International Code of Diseases, the ICD. I think as of right now, we're on the 11th edition. And in there, you will find all the mental health stuff along with every other diagnosis. In Europe and everywhere else, they've got their own manual. When you sort of match the two up, they're very close. There are some differences, but it's very minor, right? So they're pretty close. So if you're in Europe, this is what you're going to get, more the ICD-9, or sorry, the ICD-11. If you're in North America, you're going to get the DSM diagnosis. When you go see a therapist, we do 3 basic things. We do an assessment, we do diagnosis, and then we do treatment. The assessment is initially done by asking a whole bunch of questions. The more formal ones that are done, it's not the way I do it anymore, the more formal ones have different categories they go after, like childhood development, teenage years, education, psychosocial problems, sexual health, blah, 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 and it just keeps going. They go through different categories. I don't do this type of assessment anymore because I don't use the material. But the whole point of the assessment is at the end of it, you come up with a diagnosis. Once you have a diagnosis, that leads to the type of treatment that best works for the particular problem. The basic model is assessment, diagnosis, and then treatment. The diagnostics is done through a manual everybody uses to agree upon what the disorders are. So when you come into your first